We encourage you to, there you go, and it's being recorded. We encourage you to participate by leaving and dropping comments throughout the session into the comment box, using the comment box. If you have questions during our Q&A segment, please type them into the chat box, and our chat monitors will make sure that they reach the panel. And lastly, if you experience any technical issues during the call and need support, feel free to drop a direct message to my colleague, Bailey Rivas, also in the chat. And so now on to our agenda for today. We have a fantastic lineup of speakers. I'm biased because they're my colleagues, and they're going to be providing valuable insight into critical issues at stake this election season. For starters, we have Jen Taylor, Senior Director of Government Relations. She'll discuss the legislative landscape and what's at stake in the upcoming elections. Sophia Tripoli, Senior Director of Health Policy, will delve into key policy areas. And I'll share some strategy, partner resources, and opportunities for advocacy in the months ahead. And last, but very far from least, we're honored to have Anthony Wright, our incoming Executive Director, to be with us today to kick off this conversation. Many of you know Anthony and his work throughout his tenure as Executive Director for Health Access California. And we're happy to have him today. We're happy to have you today. And with that said, I'll hand this over to Anthony.
Thank you, Tasha. Good to connect with all of you. Again, my name is Anthony Wright. I'm the incoming Executive Director for Families USA, and I've had the pleasure of working with many of you over the last 25 years of consumer advocacy in my experience in New Jersey and California. And I'm also excited to start to talk to many of the new folks that I have yet to connect with, but I look forward to. I don't officially start till mid-August, but I don't want to wait. This is an urgent issue, and so wanted to say hello and also talk about the urgency of this moment. We know the folks on this call know the threats that are on the ballot, whether it's to abortion rights, to the ACA, to Medicaid and Medicare, to the progress that we've made on health equity, that and the need to rebut some of those threats to specific communities, whether they to be immigrants or the LGBTQ community or others. We wanted to have this town hall to highlight and uplift the many resources that exist this election year for healthcare advocates, and to offer the partnership of Families USA as we figure out together how can we work to advance our agenda for health justice, health reform, and health equity. We don't have all the answers, and we know we don't have a lot of time, but we wanted to have folks come together, have the hundreds of folks together of us to remind ourselves that we're not alone in this fight. I believe that the health advocates on this call have an important role to play this year. So far, we've had a campaign season that really hasn't talked about the issues and what is at stake, especially on healthcare. But even so, year after year, when Americans go to the polls, they're thinking about healthcare, whether it's their insurance premiums, prescription drug prices, just ability to access and afford care to start a family or a new business. And the cost of healthcare, the access to healthcare cuts across all of that. You know, we've talked a lot about affordability this year, but voters have been screaming about healthcare affordability for years, if not decades. And so there is a role for us to play. And I recognize that many of the groups on this call do not endorse candidates for president or for other races. And that's true for Families USA as a nonpartisan, non-endorsing organization. But that doesn't mean we can't raise issues and that we can't engage with the process. Whether you're a 501c3 or 501c4 organization, there's a role for you to play and to be part of this conversation this year. Think of it this way. Later this year, just to take one example, in the lame duck session of Congress or in the next year with a new Congress, we know that one of the things that we'll be debating is the extension of the enhanced tax credits from President Biden's Inflation Reduction Act. If they are extended, we'll continue to have a cap for Americans in terms of what they pay for premiums for no more than 8.5% of their income and less on a sliding scale. If they expire, the average premium goes up to $700 annually. And for some people, it's thousands of dollars annually that premiums would spike. For a couple in their 60s, just over 400% poverty, it could be as much as $17,000 premium spike in what people will experience. And that spike would also mean that 5 million people who recently gained coverage could potentially lose it. So when we're advocating for that extension next year, what would we have wished we had done this year to shape that debate? What can we do now to get folks on the record so that when policymakers are the most susceptible to public sentiment? What can we do now when voters are paying attention during rate announcements this summer and fall and through this campaign season? We know there isn't a lot of time, but let's just imagine all the news that has just gone on in the last week, in the last 2 or 3 weeks. We have over 100 days until the election, around 14 weeks. That's a lot of time to raise healthcare to be one of the central issues of this campaign. And the groups on this call that I have so much respect for, that I think have the credibility and I think the capacity to talk and elevate healthcare issues and to be clear about what's at stake in November. Because we know healthcare is on the ballot. Abortion and reproductive health is on the ballot. The ACA, sadly, once again, on the ballot. So is Medicaid and Medicare, and the health of the communities that rely on these programs, including low-income families, seniors, and communities of color. Additional affordability assistance for healthcare premiums is on the ballot, and many people don't know they're at risk of losing that. And the question of affordability for healthcare is on the ballot, whether it's on prescription drug prices and the ability to negotiate for better value, or on the broad range of issues on healthcare, whether it's on medical debt, dealing with high healthcare prices, or just the basic ability to afford coverage. So this is a big moment. What we do, we're not going to win some of these issues this year, but we could lose them if depending on what happens in the election and depending on what we do this year. So I'll let my colleagues provide more details and point to resources and opportunities. I hope this is a beginning of a conversation that includes one-on-one conversations later that start in Q&A. I know that's been ongoing for many of you in the states and in partner organizations that I've started to talk to in my new hat. But in the days and weeks ahead, I look forward to working together with all of you to amplify this message that our healthcare is on the ballot and what is at stake in this election. And with that, I'll pass it back to Tasha.
Thank you so much, Anthony. Well said. And it's just the beginning and the start of a very important conversation. And so with that, I'm going to go ahead and pass it to Jen, who's going to give us a rundown on the basics of what's going on the ballots this year and what we need to really be focused on. Jen?
Thank you, Tasha, and thank you, Anthony. And really thank you to all of you for joining us today and taking time out of your busy afternoon or morning, as the case may be. I know it's certainly a busy day here in DC, and I imagine you guys all have a lot going on in your worlds as well. So I wanted to start, before I get into any detail here, I want to acknowledge the many people on this call who not only know deeply about the issues that are at stake, but have worked for years, in some cases decades, I promise not to name any names, on these issues, both in the election context and in, sometimes writing some of these policies we're talking about defending in the first place, who have been through previous battles before. And so I want to lift up that I'm not here today because I think I'm going to teach you anything new about this, but I think it's a really important moment, like Anthony said, to come together and really remind ourselves all that we have accomplished and all that is at stake in this election in many, many different ways. And as we were talking about, the US presidency, which certainly the top of the ticket sets the tone for everything else. And, the president of the United States has, incredible power and ability to set administrative policy, to be making judicial nominations, to in every way influence our health and healthcare in so many aspects. So it's not a small thing that we're all talking about the presidency, but it's also not the only thing. And I think, like, Anthony referenced, it's easy for the issues to get lost here. It's easy for people, depending on what state you're in and how, what's on your ballot, you may not be thinking about some of these other ways that we should be thinking about healthcare and other ways to engage. And so I'm talking about control of the US Senate, which, as you know, every 2 years, a third of the Senate is up for election. That means this year there are 34 Senate seats being contested. It's a much bigger uphill battle for Democrats, who are defending Democrats and independents who are holding 23 of those seats, and 11 of them being held by Republicans. There is at stake control of the US House, where all 435 seats run every 2 years. 31 of those do not have an incumbent running. So, you're going to be looking at a new member one way or another, regardless of party. There are 11 governorships being contested, I think 2 of which, New Hampshire and North Carolina, are particularly contentious. But flagging that a lot of you may be doing work around your governorships in your states and in 2 territories. And we've got 85 chambers in 45 states of state legislatures that have elections this year too. So all the way down the ballot, let alone the many ways that your city, local, legislators, officials, city councils are all also obviously on the ballot. And one other thing I wanted to remind ourselves, ballot initiatives always, come up around healthcare. I think this year, and what we're going to focus on today's presentation, is talking about those related to abortion care, which I think is where there's a significant component of ballot initiatives this year. But I also want to lift up, across the country, there are measures on minimum wage, on paid leave, on housing. I think it's Nevada has sales tax exemptions for child and adult diapers. These are really meaningful issues that not only in sort of a downstream way in terms of who you're electing and what policies they support, but that in a very direct yes or no way, you have an opportunity to influence the health of your communities in this election. And so I want to thank you to everyone in these states who are working on really important issues and carrying a lot of critical water for all of us and setting the tone for the kind of country we want to live in and how we value health and healthcare. And I think Anthony already covered this. I promise not to beat you over the head about it. But, I feel like there's always this question about, is this a healthcare election? And I would argue that every election is a healthcare election, because our health and our healthcare are one of the most salient issues to all of us, for our families. And part of that is always about the affordability of healthcare. So the quality of care we get, the access to care, but also the affordability. And that's the cost of our health insurance premiums. That's the high and rising cost of prescription drugs. So anybody who's telling you, well, this one isn't a healthcare election, I think are very mistaken. I think that affordability and healthcare are inextricably linked. If you can't afford your care, you can't stay healthy and be working and, secure a livable wage. And at the same time, the high and rising costs of healthcare really put, people into medical debt, so much pressure on stagnating wages, increasing premiums that people can't afford to get that care, and round we go. So my takeaway from all of this is that every election is a healthcare election. Don't let them tell you otherwise. And with that, we'll jump into a couple of the issues. I'm going to kick us off on the issue of abortion, which I think there is not a person on this call or in this country is not well aware that this is a significant issue right now, and definitely on the ballot in November. The short summary here, since so much has happened, as we know, in the last several decades, but certainly in the last 2 years, since the fall of Roe versus Wade, we've got 14 states that have entirely banned abortions, with at least 5 more that have a very early gestational age limit, which can functionally serve as a ban. We also have additional states that have in some way infringed upon abortion rights, set restrictions. We've seen additional threats, not just to abortion, but to broader reproductive health care in terms of contraception, IVF. And, there's a lot to be really concerned about here. Obviously, we know there's a presidency and the tone they set, members of Congress, and whether or not they can, reinstate or codify a Roe kind of protection. Whether we're going to be appointing Supreme Court justices that support abortion rights and how they interpret the law. But I think that I also want to say there's a very, very direct way that folks are going to weigh in on this issue again in the election via ballot initiative. And since 2022, there's been 7 state ballot measures related to abortion restrictions, some in favor, some opposing. And all 7 have gone in favor of abortion rights, which is a huge testament to the folks, I'm sure, and this call in those states. And all the work we've done to raise awareness about this. It's obviously a really salient issue for people. It is activating folks. They are going to the ballot because of it. And we've got more than a dozen states, likely 12 to 13 states with abortion ballot measures in November. I think 6 or so have already been certified and others are coming in. So you're going to have a very direct look at how people are responding to the abortion bans and threats on reproductive health care that we've seen in the last 2 years. And I think another issue that I think will surprise no one that we're going to talk about today is protecting and defending affordable coverage. Certainly the Affordable Care Act and the components that relate to, Medicare, Medicaid, the marketplaces, but also a broader look at federal threats to Medicare and Medicaid. And so I hate to belabor this. I feel like so many of us see this slide, and whether you feel really energized about the folks who put their bodies, literal bodies, on the line in 2017 to push back the last big repeal effort, and how you feel about, John McCain's thumbs down on top of Senators Collins and Murkowski with all of the Democrats opposing that repeal. It can be very motivating, and it can also be really exhausting. And so what I would say is, I know in terms of history repeating itself, it's difficult to be here and again talking about the future of the ACA, but we know how to fight for the ACA. Some of you on this call helped write it. Most of us all fought to pass it. We fought to keep it. We have kept it going since, through Supreme Court threats, through a previous administration that at every turn sought to undermine consumer protections, create loopholes, allow for the proliferation of junk plans. And here we still are, and it's still the law of the land. This Biden-Harris administration has obviously been incredibly supportive of the ACA and both turning back the previous administration's regulations to gut some of the enforcement and consumer protections, and also advanced at every turn, I think, the cause of affordable care. And so whether we're talking about a full repeal, which people can say is on the table or not, depending on what suits them in the moment, but I would also say we should all look back to people's records and past prologue about what their positions have been and whether or not they'd be supporting the ACA or looking to repeal things, even when they're very popular, including all the consumer protections and the free preventive health care, certainly federal Medicaid expansion. I'd also be wary and remind folks that we know that cuts to Medicaid can come in all different packages, including through federal and state budget cuts, or restructuring, plans like per capita caps, block grants, certainly work requirements, which administration is in power, which 1115 waivers do they want to approve or not approve, as the case may be. And if you're looking, also there's a lot of talk that, of course, nobody's ever going after Medicare because everybody loves older Americans and their care and would absolutely protect it. But you can also take a look at the plans that are floating, whether that's Project 2025, or I think AEI released a plan yesterday talking about the further privatization of Medicare, pushing everyone in traditional Medicare into Medicare Advantage, raising the age of eligibility to 67, converting to a voucher program. So again, I remind us all that in every possible way, these programs that help keep healthcare affordable for low-income families, for working families, for Black and Brown families in this country, for older Americans, for veterans, these are at stake. And again, I wouldn't let anyone convince you otherwise. I would look to their record on that and make sure that we're all fighting to support elected officials and candidates for office who support us in terms of our affordable health care. There's also 2 specific things I wanted to call out related to affordable care before I hand the mic over to my colleague, Sophia. The first is on state Medicaid expansion. So obviously there's a lot to talk about in the world of federal Medicaid, what could or could not be on the table, how we want to continue to move forward on closing the coverage gap. But there's also active work happening in these states, these 10 states that have, yet to expand. And I also want to remind us all that Montana's expansion actually has a sunset provision. So we're talking about 10 to 11 states that could have, Medicaid expansion in question. First, more than anything, a tremendous shout out to all of you advocates in these states who have not given up the fight. We see you, we appreciate you, whether that's Mississippi, who got so close this year and has so much to be proud of and to build on for next year. We know folks in Wyoming have a re-energized campaign and are going to come in strong this year and trying to get this over the finish line. Folks in Florida who are setting up towards a ballot initiative, maybe not just this year, but in 2026. We know that work continues, and we appreciate all of you. And also want to say that this is an opportunity. Some of these states that have not yet expanded Medicaid still have state primary elections, which I think sometimes we forget about when we're so focused on the presidential election. You've got 4 states here who could expand Medicaid, and setting up now to elect lawmakers, regardless of what side of the aisle they're on, who support expansion. Expansion has happened in red states under red governors, and can happen again and will happen again. But you got to be electing state legislators who support expansion. And so just reminding folks there's an opportunity to engage there. And then, of course, no talk about affordable coverage this year would be complete without also talking about the advanced premium tax credits, which we know have been instrumental to creating affordable care in this country, certainly since enacting the ACA, but have been extended several times, most recently in the Inflation Reduction Act with the enhanced premium tax credits. I think there's no question that increased affordability is what helped get us to historic marketplace enrollment, over 21.3 million people as of the beginning of this year. And this is at risk in this election. We cannot take this for granted. We know that these are set to expire in December of 2025. When you're talking about Congress, they'll great, that gives me until December 29th-ish of 2025 to start working on this. But we all know that's not how this works. We know that insurers are going to submit rates. We're going to have rate announcements. We're going to have open enrollment next year, all before this ever expires. And so we're going to need action now. And we're going to need commitments from the people who are our policymakers and decision makers, that they understand the importance of affordability here, and that they're going to stand up for working families who are going to rely on these subsidies to be able to maintain their health insurance. Obviously, we want to see them enacted permanently. That's what we'll be fighting for, and many of you. And I do want to give a shout out to our partners, and we'll drop it in the chat as well, that there's going to be a great specific focus webinar on this next week, hosted by Community Catalyst, with Protect Our Care, CAP, Leukemia and Lymphoma Society. I am missing somebody, which feels terrible. I'm going to give you a shout out, I promise, as soon as I think about who it is. CBPP, how could I forget? Sorry, guys, you're doing so much good work. I can't keep track. But we'll put in the chat too. We'll encourage folks to come back and talk in more detail about your opportunities to engage specifically on the APTC issue this year. And with that, Sophia, I'm going to pass it over to you and look forward to discussion at the end of the call.
Awesome. Thank you so much, Jen. And good afternoon, everybody. And good morning to our West Coasters. It's really nice to see everybody. And thank you guys so much for taking the time to be with us for this hour. As folks know, in addition to the threats to the ACA, APTCs, Medicare, and Medicaid that will impact so many people's lives in this country, we know that the outcome of this election will directly impact health equity, racial justice, and access to health and healthcare for immigrant communities, communities of color, LGBTQ+ communities, and many, many others. As you're hearing, and you'll keep hearing, of course, it is so important that as you are talking to your members, candidates, communities, that folks really understand the progress that has been made over the last 3+ years and how quickly that could change depending on the outcome of the election. There should be no doubt that health equity, anti-discrimination in healthcare, and health and healthcare justice are absolutely on the ballot this November. Over the last 3.5 years, the Biden-Harris administration has not only worked to reverse many of the Trump administration's discriminatory policies that caused direct harm to many communities and significantly limited access to healthcare, but they've also implemented a significant number of policy changes that have really helped to push our nation forward when it comes to addressing health equity, protecting people from discrimination in the healthcare system, and ensuring that all people living in our country actually have access to affordable, the affordable quality care that they deserve, that we all deserve. There is, of course, so much more work to do to really center health equity and health justice in the U.S. healthcare system. But the outcome of this election will undoubtedly determine whether policymakers and advocates can continue to build in the progress of the Biden-Harris administration and the work of so many of you who are joining us on this call and many others who are not here, or whether we will once again be defending against concerted efforts to undermine our healthcare programs and significantly restrict access to health and healthcare for many communities, families, and individuals all across the country. While what you're seeing up in this slide is not an exhaustive list, we did just want to highlight several key regulatory changes, policy changes that were made under the current administration that could be under very direct threat depending on how the election goes this November. And just to get into it, in May of this year, the Biden-Harris administration published historic new regulations that extended eligibility for marketplace coverage to DACA recipients. This reg goes into effect on November 1st, just in time for the open enrollment period for 2025, and will allow for the first time access to healthcare for more than 100,000 Dreamers. In 2022, the Biden-Harris administration proposed and finalized a new public charge rule, which reversed the public charge policy changes that were implemented by the Trump administration. And as a quick reminder, the Trump administration's public charge regulation made a number of significant changes to a variety pieces of public charge, but including the scope of the programs that the federal government would consider in public charge decisions, including a decision that would essentially allow federal officials to deny entry to the U.S. or make changes to residency status based on whether immigrant families and individuals were accessing programs such as Medicaid and SNAP and housing programs. These changes, as folks might remember, very significantly increased fears among immigrant families about participating and seeking services, including healthcare coverage and healthcare benefits broadly, and really resulted in many immigrant families, including citizens, from disenrolling themselves and their children from healthcare programs or foregoing enrollment in healthcare coverage altogether, despite the fact that many folks were actually eligible for these programs in the first place. In 2022, the Biden-Harris administration published a final rule to fix the so-called family glitch, which enabled about 5 million mostly low-income Americans and their families who previously were ineligible for subsidies and therefore were unable to afford healthcare to newly qualify for subsidies in the ACA marketplace. And this, of course, took effect in 2023 plan year. As folks know, there are also a significant number of threats to the LGBTQ+ community, including on gender-affirming care. In 2023 alone, we saw more than 450 anti-LGBTQ+ bills introduced across the states. At the federal level, there have also been a number of bills introduced that would put a national ban on gender-affirming care for minors, as well as other legislation that would restrict access to healthcare for LGBT communities. It's also important to note that there are opponents to those bills, lawmakers, who have also introduced legislation that would enshrine protections to healthcare access and other essential services for the LGBTQ+ community, including for transgender people. The Biden-Harris administration has long opposed the restrictions on gender-affirming care and restrictions to healthcare access based on sexual orientation or gender identity. And in 2022, they issued guidance to state attorneys generals warning that bans on gender-affirming care are unconstitutional and violate several federal laws, and that physicians and other healthcare personnel are not required to disclose patient information regarding gender-affirming care, as well as that denials of care based on gender identity are in fact illegal. The last point to hit on here in this slide is about what the current administration has done to extend additional protections against healthcare-related discrimination, including for LGBTQ+ people. As folks know, in April of this year, the administration finalized long-awaited revised regulations that implemented Section 1557 of the Affordable Care Act, which is the non-discrimination provision of the ACA that prevents and prohibits discrimination on the basis of race, color, national origin, sex, age, and disability in specific healthcare programs. The interpretation and implementation of Section 1557 has shifted dramatically across the Obama administration, the Trump administration, and the current Biden-Harris administration, especially as it relates to the scope of entities covered by the law and the law's ability to provide non-discrimination protections based on sexual orientation and gender identity. The Trump administration took a very different tact than the Obama administration and reversed all of the Obama era gains, including removing protections against discrimination based on gender identity and sexual orientation. But the Biden-Harris administration, in their 2024 final rule, reversed the Trump era rules and both reinstated and expanded on the Obama administration's protections against this type of discrimination. Whether we are talking about anti-discrimination, protections for LGBT plus individuals and communities, or health equity and racial justice in the healthcare system, or immigrant health and access to care, the stakes of this election could not be higher. And regardless of what district or state you are in or what community you live in, it's so important for elected officials and lawmakers and voters to be thinking about how the election could not only impact our individual health, but also the health and well-being of our family members, our friends, our neighbors, our colleagues, and our communities. Shifting gears a little bit, I want to talk about, we'll talk a little bit about drug pricing reforms. Obviously, the outcome of this election will, of course, play a significant role in the future of the Inflation Reduction Act, and not only protecting the gains that we've made on drug pricing, but also the ability to continue to build on those reforms. As you'll see here, and as folks know, drug price reforms remain extremely popular among voters across the political spectrum, yet we know that Republican lawmakers have mostly opposed the Inflation Reduction Act. It's important to note that the IRA was passed by Congress and enacted into law without a single Republican member of Congress voting to pass the bill. And the threats to the IRA not only include the possibility of the law being fully repealed and other congressional attempts to undermine the existing law, but the law could also be subject to significant threats through rulemaking, given the Secretary's authority over the Medicare negotiation program. We already know that drug companies have brought a number of lawsuits challenging the IRA, which of course is important to remember requires the Department of Justice to allocate resources to defend against, all of which could be significantly impacted depending on the election outcome. Given the partisan split on drug pricing reforms, it's also important to note that our ability to build on this progress of the IRA is also at risk. That includes the ability to extend the inflationary rebates into the commercial market, the ability to extend Medicare's negotiated rates into the commercial market, the ability to increase the number of drugs that Medicare can actually negotiate prices for, and so on. And while drug pricing reforms, and particularly the IRA, have been largely partisan, these efforts, as has been noted before by Anthony, are part of a larger movement that we have collectively been building for decades, a movement that has been focused on holding the healthcare industry accountable for our nation's healthcare affordability and quality crisis. This movement has been steadily growing and has resulted in major wins to enact protections for consumers against surprise medical bills, wins to enact drug pricing reforms, and now a concerted effort to unveil the role of corporate healthcare abuses, and specifically the impact of healthcare industry consolidation and driving up healthcare costs and driving millions of people living across this country into medical debt. While there is much, much more work to do, lawmakers from both sides of the aisle, both nationally and in the states, are awakening to the ways in which the healthcare industry consolidation is driving anti-competitive behavior and is resulting in ever-increasing healthcare prices across the U.S. healthcare system. Whether you're in a district or a state talking to Republican or Democrat candidates, healthcare consolidation and corporate healthcare agreed are issues that you can and should be lifting up. Decisions about who will be in the White House, Congress, governor's offices, state legislatures will of course be critical in our efforts to continue making progress in our movement to hold the industry accountable for our nation's affordability crisis. And at the same time, we have to also remember, as we look to what else we can actually do in this current Congress with this current president, we know that there's going to be a significant push at the end of the year to get a number of policies across the finish line. This will be our last chance in this Congress to enact things like price transparency, site neutral payments, address the anti-competitive contracting practices that we're seeing as a result of all this outsized industry consolidation and market power. These types of provisions would be significant steps in beginning to rein in the impact of consolidation and medical monopolies from driving up healthcare costs and as a major driver of our nation's healthcare affordability crisis. We can absolutely get this done. Some of these policies can actually make it over the finish line. So a reminder, as you were talking to your members about these issues, both for the election and in our end of the year push, make sure your elected officials are putting the interests of people living in America ahead of the greed of big healthcare corporations. And with that, I will turn it back over to Sasha.
Thank you, Sophia. Thank you, Jen. I'm going to echo a few of the things that you said before we go into which might be my favorite part. It's not lost on any of us, the work that you all are doing. It's definitely not lost what's at stake and how very critical it is that we continue to do this work and do it together. And so I'm going to round us out, and I'm going to talk about bringing the conversation right back to you, right back to us, right back to the community and collaboration. So we're going to dive into our Families USA Partner Toolkit, our Healthcare on the Ballot. This toolkit, as you see on the screen and this slide, was designed to align our collective strategies and drive the impact through collaboration. I think Jen said it earlier, we by no means think that we own this work, that we're starting this work, but we certainly know that we do this work best together. And so this toolkit will live on the Families USA Action website, and the website is there, and we can drop it in the chat as well. It offers practical guides, templates, best practices to support your advocacy and programmatic efforts, key resources, including fact sheets surrounding the issues that my colleagues just spoke on, and sample social media communication templates, step-by-step advocacy guides, in addition to shared resources from our partners like KFF and Center on Budget and Policy Priorities, HHS, CareQuest, just to name a few, and those of you that are on this call. And this isn't an exhaustive toolkit, it's a living document. We welcome you to send us any of your resources, send us questions about things that you want to see there. We want to be a partner with you in this. We want to be in the walk and the movement with you with this. And so that's what this toolkit is for. So we encourage you to check back often. Let us know if you have resources. Let us know if you'd like something to add. There are a few ways you can get to us, and you can drop it in the chat right now. No better time than now. Or if you think about it later, you can email us at partnerships@familiesusa.org. We can go to the next slide. And so we can talk about how we leverage these resources effectively. This is really a call to action through engaging with the toolkit and incorporating the resources into your advocacy strategies. This slide lays out several ways to activate this, from press conferences that grab attention, town halls and district meetings that mobilize and put your constituents right in position to directly address candidates and policymakers. Whether you publish an op-ed, create a social media campaign that uplifts, uncovers, reveals, and drive home the real-world impact of policies on lives that are living the experience every day through storytelling. The point to keep in mind is that these methods of engagement can be used in a single moment or multifaceted as an approach to have powerful influence in shifting the public opinion and policy change. That sounds nice, but the fact is that it's real, it's tangible. These are the tools that hopefully will get you to the marker, and certainly that we can share together. The power of collective action and strategic execution contributes to broader systemic healthcare change. And so, next slide, we'll talk about when to engage. I think the hallmark of good strategy is seizing the right opportunity. And so that's what this slide is bringing you, the opportunities. Here we've laid out a few key dates and observations that will position your advocacy movement in the right space to amplify the message, connect the power of timely execution, and just increase the impact. So I'll talk through some of these dates, and we will, again, I think someone asked in the chat earlier, but we will have these slides available along with the recording, just for your reference. On July 31st, the anniversary of Medicare and Medicaid. So this is a time where you can highlight the program's success. You want to target with social media blasts or release statements celebrating the program's impact. We can couple the action and then engagement, that extra punch. We've got the rate review announcement coming on August 1st. We've got congressional August recess, the 5th through the 30th. So there's time. And I think Anthony spoke to that. It seems like there's not a lot of time, but we've got enough time. to move mountains. If not mountains, we can move hills. And I'm okay with that if that's it. August 16th, the anniversary of the Inflation Reduction Act. And then September, we've got the announcement of the final negotiation rates for the first 10 drugs in Medicare negotiation program. So these are big moments. You know, they're not lost on us. So we're hoping that you can capitalize on these moments. Even as far as back to school session, right? This is the moment we can talk about the importance of children's health. We can partner with the schools. We can partner with the child care providers. We can really talk about the things that matter to our communities, our constituents, our families. And then Labor Day, we can even impact the rising health, we can spotlight the impact of rising health care premiums on wages. And so they're moments and opportunities, and hopefully this is just a glimpse of how we can definitely use this to help as we continue in the movement. And so last but not least, in our final slide, I just want to say that we can't emphasize enough how critical our partnership work is. We are definitely in this together. We want to be a partner, an ally, continued resource in this work with you. We want to amplify your efforts. We're committed to working together to do that. And so, as I mentioned it before, I'm sticking to it. We want your events. We want your resources. We want you to share that with us. And if we have some that you want and you just didn't see, we want to hear that too. Drop them in the chat and then email us at partnerships@familiesusa.org. And just as a reminder, there are a few events that we would like to highlight on this call. There's a deep dive on APTCs with community catalysts and partners happening on July 30th at 2 p.m. Eastern Time. And we can post the links in the chat as well. And then you can find more partner resources in the healthcare on the ballot toolkit. So the toolkit is there, it's live, it's ready for action, it's ready for you. And with that said, I'm going to close this part of the presentation out. And I hope that you got something from this. I hope that this was helpful and insightful for you. And we want to make sure that we have time to open it up for questions. And so right now is the time to put your questions in the chat, and I think we have one. And so I'm going to go ahead and I will start with the first question. I will open it up to the panel. Question is, can you further discuss why we need to address APTC permanency before end of 2025?
Looking at my policy partner in crime, but since I talked about it, I'll take the first stab, Sophia, and let me know if there's anything you want to say. I think when it comes to APTCs, obviously, when it can feel like, oh, that's a year and a half from now, which since every day feels like about a week and a half these days, it feels like a very, very long time away to imagine where we'll be in December 2025. But we tried to highlight just a couple of the reasons on the slide, which is just to say that everything that goes into, an insurer determining their rates, people knowing what can they afford to pay, understanding what their options are going to be, and then going through an open enrollment, all would happen before the APTCs expire. So if we leave it until next December, you are going to create, honestly, chaos, a situation in which people don't know what they're eligible for, what they can pay for. Insurers are guessing based on what they think Congress will or won't do. And you have the potential to undo, where we've got more than 19 million people, I think it was like 92% of people in the marketplace received some sort of affordability assistance, to drastically sort of have the bottom fall out on that and people not know what they will be eligible to sign up for, what can they afford, if they're counting on a subsidy that's not going to be there a month later. That's a significant problem. And so sort of in every aspect, this is something that needs to be addressed earlier, and it's sort of this basic guarantee that nobody would have to pay more than 8.5% of their household income on premiums. That's a very different calculus than if we're going back into a space where people have absolutely no idea what that premium is going to be and if they can afford it.
I'll also just underline, because we dealt with this in previous iterations of this of the debate around subsidies, that insurers file do their actuarial assessments and do their rates like in early in the year for 2026. They would be doing it in in March, April of 2025, in order to then have them announced in this July, August period for them to be then rate reviewed and then have them in effect for the open enrollment period. And those actual assessments are based on the fact of how much subsidies are available, because that has an impact on enrollment. We know that 5 million more people are enrolled because of these subsidies. If you don't have these subsidies, then they have to calculate rates based on a smaller and sicker pool, which means that premiums would actually go up and create, again, what folks call a death spiral in our insurance market, right? And so it is a big deal. In fact, so much so that some exchanges, like Covered California and others, actually ask the insurers to file two rates, one with subsidies and one without, just as but not every state exchange is going to do that. And then again, as was said, that creates chaos. So the more that we can do this up front, frankly, we can do that in the lame duck. That's important. And that's why this needs to be an issue that we talk to our representatives about now. Even if we don't care about the election at all, this is the moment to talk to our elected representatives at the federal level and say, what are you doing about this? How can we get this done so that the insurers and health structures and health exchanges can actually have a plan for what 2025, 2026 looks like. So we need to do that. And if it has the broader effect of educating people about these subsidies and educating voters about what's at stake, all the better.
Thank you, Randall. I'm going to move on to the next question. When we talk about the attacks and threats on Medicare program, what are the opportunities to rein in the abuses we're seeing in MA? What's at stake when it comes to Medicaid Advantage policy?
So I'll jump in on that one first, and then you guys can jump in after, obviously. I think what a great question. Thank you. I think obviously just in terms of like big picture Medicare, some of the plans we're seeing, whether it's Project 2025 or the AEI report, is talking about one of the bigger threats is around sort of the further privatization of the Medicare program, the whittling away of traditional Medicare. That, of course, can look like a lot of different things, including more Medicare Advantage. I think it's important to remember that more than half of beneficiaries in the Medicare program are in Medicare Advantage. So your point about how do we make sure that we are actually holding the program accountable to deliver on its promise of making sure that all seniors and people who rely on Medicare get the care that they need is so important. I think on the coding abuses, I think, and some of the overpayments that we're seeing and some of the other abuses, I would put this, my read of this is, I would kind of put this in the category of a more of a bipartisan interest. I think there is a lot of concern about the outsized impact of industry power across a variety of healthcare programs, including Medicare Advantage. But I do think there's much more work to do to shore up exactly what that should look like in terms of policy solutions. We did see the Biden-Harris administration try to address some of those coding abuses, and they received a massive pushback from industry. So that should be a signal to us as advocates and others who care deeply about these issues and making sure that we are not that we are holding the healthcare system accountable for costs and quality. That there's a lot more work to do with lawmakers, both Republicans and Democrats, to help give a sense of what that should look like. But I do think that that's an area where there is potential for some bipartisanship, depending on the outcome of the election. That's my take, but Anthony and Jen, you should jump into it.
Anthony, Jen, did you want to? Okay. Well,
I think she covered it well. I'm not going to add to that, but yeah.
As always, that is definitely true. And it's actually a really good segue into the next question. The next question is there any discussion about how we can hold insurers more accountable and demand more from them on delivering more benefits for less costs?
I think I'll just say, I think, yes, 100%. I think there's, I do think that there's a lot of interest in making sure that generally that we are getting more out of the healthcare system in terms of the quality at the price that we're paying. And so I do think that lawmakers are awakening. I think there's a lot of attention on sort of the rising healthcare prices and costs and affordability and quality from the provider perspective. But of course, insurers have a role to play. And so I do think that there is an appetite for that conversation as well.
Thanks, Sophia. The next question, it says, thanks for the presentation. So that's a wonderful way to start the question off. Besides the 10 states expanding Medicaid, are there near-term opportunities for federal policymakers to help address the coverage gap?
I'm happy to jump in. I know we're like looking at each other.
I think that one was
feel very much like the Spider-Man situation. Okay. My computer is just really having a glorious time. Can you hear me? Thumbs up. Okay, great. I was just going to say, I'm happy to jump in on this. And again, obviously invite my colleagues to add anything I may have missed. I think the short answer is yes. There are currently and will continue to be efforts to address the coverage gap and Medicaid expansion federally. It's obviously very challenging, and in talking about today, what we're trying potentially in a place where we're fighting to defend as far as we have gained, and so it can be a difficult conversation about where we go from here, which is once again why it matters who represents you in office and what their viewpoint on this is. But I think as recently, I think it was last month, a couple weeks ago, Senator Warnock again led an effort and with his colleagues on looking at ways to approach this issue. He's previously introduced sort of more permanent federal fixes. He's now taken a tack of really looking at providing at least a bridge to Medicaid expansion for these 10 states that have not expired and the almost 2 million people, I believe, that live in them that are lacking coverage by utilizing the premium tax credits and allowing folks to buy and get a no-cost affordable plan in a marketplace instead of having Medicaid coverage in the interim. So obviously the ideal here continues to be, and I think Mr. Warnock, Reverend Warnock would say above all else, that states should be expanding their Medicaid programs so that folks can benefit from the full suite of services that Medicaid covers. But he put together a really thoughtful bill that is ensuring some really foundational coverage pieces, emergency care, some particular essential benefits, things that would be provided by a private plan in the marketplace in the meantime, so that we can provide a bridge for folks as we get to full expansion. So those efforts continue. And I know many of you on this call have been extraordinary partners and leaders in not giving up a federal coverage gap solution here that would include Medicaid expansion and really, addressing folks who, for no fault of their own, have done everything right and their states have been denying them coverage. So work on both ends will continue. And I know that will continue regardless of outcome in November, but certainly we have a much better shot at it if we have people in seat who understand the importance of closing the coverage gap.
Thank you, Jen. We're going to do one more, and then we will do our final wrap-ups. The last question, I'm not in a state with a competitive Senate race or a presidential battleground. How can I engage? It's a really good question.
Well, I mean, I would just
California, go to you, Anthony.
Well, I mean, there's lots of states that have important House races. I mean, so even deep blue states like California, New York actually have really important House races. Both of those states are a great example, but frankly, lots of others. So I think it's also important to just contribute to the national narrative, right? Like we're all our social media is no longer stops at the state's border. It goes beyond. If we're trying to do a drumbeat, we're trying to get a drumbeat that goes across the country around these issues. And so So yes, those of you who are in swing states, those of you who are in Senate race states, those of you who are in House swing states, you're on the front line, but we all have a part to play in this effort. So I would say that number one, and raising these issues of what's on the ballot, et cetera. And I appreciate that. We've gotten a little wonky in this conversation. We're not going to have placards or press releases with 1557 provision or APTCs in the headline. We're going to talk about it in broad terms about protecting whether it's abortion rights or the ACA or Medicaid or just the do you want a cap on how much you pay for premiums, or do you want to spend hundreds, if not thousands of dollars more? Those are, try to keep it at that level. But if we can keep it at that level, we can make these issues in the debate in a very specific way. So I think that it's still really important. And I do want to just highlight, in the chat, Tennessee showed some of the county specific work that was done. That's a great example of what local advocates can do. That gets press, is to highlight the local angle with local data of what is the enrollment in your exchange, what's the enrollment in Medicaid, what are costs doing in your specific county or your specific area. And again, that has salience outside of your borders as well. We know our friends in Maryland sent a letter to their representatives asking them where they are in prescription drug price negotiation. That's something to do. That doesn't matter if you're in a swing state or not. We need to get those commitments as in writing, and you'll have elected officials who will be more responsive this year than they potentially will be next year. And so get those commitments, whether it is on any of the issues we talked about, or whether it's the more local issue or in your state. My friends in California today have the rate announcement for Covered California. And so that's an opportunity to talk about both the subsidies that people are enjoying, but also to talk about the issues that Maura from New Jersey and others just talked about, of just why the hell are healthcare costs so high to begin with, whether it is whether it's the hospital rates, whether it's the prescription drugs, or whether it's the insurers and what they take off the top. Those are all things that a rate announcement, because whatever rate that they announce is too high, and we need to talk about that. And that's an opportunity to do so over the next couple of weeks as different states announce those rates, and as the federal government does so leading up to August 1. So those are just opportunities that I want to make sure we don't miss, to raise the opportunities there. So I think everybody has a role. It's different in each place, and again, there are partners. There are great partners that are having, like, whether it's the call that is now in the chat from some of our national partners, or whether it's something like the Kaiser Family Foundation has a great comparative website that shows just the different records in a totally nonpartisan way, the different records of the last two administrations. We don't have to talk about what folks might do. We can focus on what they did do. And that by itself is a totally factual, totally helpful way to get this information into the public mindset. Tasha, you're muted.
You would think, after this much of time. Well, speaking of time, we are at time. This conversation is over, but the conversation is not. And so we want to keep talking, and we want to make sure that we're still partnering and that we are here as a resource. So please save the date. There will be a post-election follow-up conversation. Date and details will be announced soon. We hope to see you there, and we hope to hear from you in between time. So thank you all for joining us, and have a good rest of the afternoon. Bye-bye.